Hi, good morning, everyone. This is Terry Torres with the Gardens Group, and we will get started in just a moment. We have a wonderful guest presenter today from Optimal Hospice Care, and we're looking forward to the exciting topic of 7 ways to keep our seniors engaged during COVID-19. So in just a few moments, we'll begin. I would say around 11:05. That way we have opportunity for all of our guests to join. So we'll talk to you again soon. Good morning again, everyone. Thank you so much for joining. This is Terry Torres, and I am with the Gardens Group. We are 3 different memory care communities specializing in providing care for those with dementia and varying degrees of memory loss in Orange County. We have Fullerton Gardens, Valley View Gardens, and of course Sunflower Gardens. And we're here partnering today with our very special guest from Optimal Hospice Care. Optimal is a part of Bristol Home Health and Hospice, and really important topic discussing ways to keep our seniors engaged during COVID-19. Of course, we know, seniors as we age, we're prone to depression and prone to, losing mobility, and all of those things can be detrimental. on a regular basis, right? But in particular with the global pandemic that we're facing, it is key to keep us engaged and active and feeling supported by our support systems and teams. And there's really no better people to help us with this topic. Optimal Hospice Care and Sara Ponce has done such a great job supporting our team at Valley View Gardens, providing hospice care services. And today we've been blessed with the Regional Vice President of Community Development at Optimal Hospice Care, Jackie Everino, who is going to be discussing the 7 ways to keep seniors engaged. Optimal Hospice Care is graciously committed to the mission that all patients and families entrusted to the care will be treated with the highest level of compassion, respect, and quality. Their hospice services provide superior care to terminally ill patients with a holistic focus on physical, spiritual, and psychological and social needs of the patient and the family. And I can just, tell you firsthand that we've definitely had that exact experience at our communities. And so without further ado, I'd love to turn it over to Jackie so she can share with you all about the best ways to keep seniors engaged during COVID-19. Jackie?
Thank you, Terry, for the introduction. I appreciate it. Well, welcome everyone. And as Terry mentioned, let's get started. 7 ways to keep seniors engaged during COVID. So let's make sure that I actually have access to do this. Hold on one second. So to protect our elderly and chronic ill from COVID-19, we've asked this population obviously to isolate at home. This is the best way to keep them safe. But how do we protect this population already at high risk for loneliness from the health risks that come with isolation? Loneliness and social isolation have been associated with increased risk for several chronic conditions, including dementia, 64% increase, stroke, 32% increase, and coronary artery disease, 29% increase. Social isolation has also been linked to increases in emergency department visits, hospitalizations, and nursing home placements. I know that you gave me access. Still having a hard time forwarding here. There we go. So let's kind of start here. Schedule a virtual story time or regular phone touch base. FaceTime or Skype to read a book or a collection of poems. Connect with family members as often as possible over the phone or as a group on Zoom. One family caregiver calls her father the same time each day to do a devotional and say a prayer. And I'll pipe in on this one. I actually do this with my family. Every Sunday at 1 o'clock, we have family back east. We get together on Zoom with my mom, which I am her caregiver. And I will tell you that this has made such an impact for her to be able to see everyone, really connect, and be able to talk to each of our family members and knowing that everyone is okay during this time. So the consistency is key as well. Also sending a quick text to stay connected, even if you can't stay on the phone. Connecting with an older adult each day could give him or her something to look forward to. Terry, you may have to forward for me. It seems like you're still in control of the screen. There we go. Encourage a loved one to keep moving. Now more than ever, it's important for older adults to stay active. They could serve the dual purpose of keeping a senior active while helping to improve balance and prevent falls. How about encourage an older adult to keep moving around the home or apartment? Even better, suggest an outdoor walk while reminding him or her to practice social distancing, which is key. Making sure that we keep them active, but then keep them safe as well. Plan a drive-by greeting. Drive by a senior's home, apartment, or care community. We have actually been doing parades to some of our communities, and we have been able to see the residents through their windows honking our horns and just letting them know that we have signs up saying that we love them, we miss them, and to stay safe. If a senior is confined to a bed, work with staff to position him or her near a window. Hold up signs or messages, like I had mentioned earlier, from family and friends. If you don't live in the same community as your senior, try to engage a family or church or synagogue member to arrange a greeting on your behalf to help your loved one know you're thinking of him or her. Resurrect popular hobbies. If your loved one likes reading, drop off or mail books and magazines they might enjoy. Some older adults like to knit or crochet, work crossword puzzles, and craft. Try to help older adults engage with those hobbies, whether it's ensuring they get the supplies they need or joining in on the activity via FaceTime, Skype, or Zoom. This is a great one. We just purchased one of these utilizing technology. It's called the GrandPad that offers a number of ways to keep seniors busy with games. And so what we're finding, obviously with bingo being out of the picture these days, these GrandPads, they do have them at Walmart. Actually, you can download a lot of these games and they're very interactive. Some of them may require your senior to have Wi-Fi, but some of them actually do not. Making meal times an activity. If seniors are still cooking for themselves, help them plan out their menus each week with their favorite healthy foods and make sure that they have a way to get groceries, such as through deliveries. We've seen Instacart has gone through the roof. Amazon is doing meals, Meals on Wheels, getting them connected to some of these resources. We have been doing sharing recipes and exchanging food on a weekly basis. It keeps them busy on doing something that's healthy, and also it's actually an activity that they truly love. Phone or Skype during meal times to help provide companionship, which can enhance appetite and the mealtime experience. Watch a show together. Highlight some of the game shows. I know for my mom, it's Jeopardy. Not always my favorite. However, I will sit and watch it with her. Um, Anything that you feel that is an interactive way to engage with the seniors, and employing technology is a big one. As our population ages, we know that they struggle with using a telephone. So making sure that we make it easy for them, having larger numbers, and being able to touch things that are easy for them to navigate, and so that way they can continue to watch their favorite programs. As I mentioned, Jeopardy, Wheel of Fortune, Family Feud, Price is Right. That seems to be some of the ones that they truly enjoy, and make it an activity. Let's see who can actually get the answer first. And it's something that they truly enjoy. Take your loved one on a trip down memory lane. This is a good one. And we actually started doing a scrapbook in our family and going through pictures, talking about them, when this happened. And typically when you're dealing with, obviously, the seniors that have memory challenges, they may not remember that they had a meal maybe an hour ago. However, they can tell you clearly about things that happened to them when they were younger. So this is a great time to look through even your own photos and sending them to the senior and discuss what memory he or she has of those photos. That's all I have. Any questions?
We do have a question, Ms. Jackie. They're asking if a slide file will be presented to the attendees, and I'd love to do that. With your permission, we can provide the slideshow.
Absolutely.
Fantastic. Thank you. Thank you for that question. Let's see if there's any other. I have a question, Ms. Jackie. How would the guests get in touch with you to learn more about the services that Optimal provides, or that Bristol provides as well?
I can actually do you want me to send a message through the chat with all my contact information? I can do that as well.
Yeah, that's great. And then while you're doing that, if we have any other questions that the group has, we'd be happy to answer those as well. So go for it.
Terry, I'll have you forward my information. I think that only goes to you. Please feel free to copy and paste and send it to the attendees as well.
Absolutely. Be happy to do that. Let's see. And then I know we talked a lot about technology, certainly, especially with COVID-19, that's key. For those seniors, Jackie, that are needing a little bit more care and support, maybe the population that you might cater to as well, in terms of end stages and things like that. What are things, practical tips that we have to help? If somebody's a little bit further along and maybe not able to participate so much virtually.
So you're specifically speaking with obviously regarding memory care, correct? You
well,
kind of
memory care, memory care might be good, or a senior that is in their end stage.
So I can give you a little bit of what we've been doing. And so obviously, I'll give you definitely some ideas, and every area has been different. Obviously, we went from our nation shutting down in March, and obviously in healthcare, we have to continue, right? And we know that we serve the senior population. So we had to get creative. And so I'll give you and for instance, we've been doing, and I've been going to all my sites and focused on really setting up these parades for, our communities where they're not able to get out. We actually did one here in San Diego, and it's a memory unit. They had lined up all the residents in the area where there was a large window. We actually brought our therapy pony, and they were able to actually see the pony from inside, so they were safe. But we realized that we have to bring those resources to them, whether it's music, which definitely when you're working with residents that have memory, that need to have memory challenges, then that's a big piece of it. We've been doing, as I mentioned, parades. We've been really an end of life focused on a couple of programs that we specialize in, which is Sweet Dreams. And that is something that's very unique to Optimal. And it's really what we call bringing a spa to some of these patients that are having challenges maybe going to sleep. And so it's not, maybe they don't want to see a home health aide at 7 in the morning. Maybe it's 6 o'clock at night when they really need someone to come in, do some light massage, really put the lighting available so that it's pleasurable to the resident, provide some essential oils, put the music in the background, have the entire effect so that they feel supported and loved. And then it helps with that sundowning. It helps with that a lot of times the caregivers are doing a lot of redirection, and especially later in the evening, they're having challenges getting some of these residents to sleep. But this has made such an impact because we've adjusted our home health visits to later in the evening, so 12 to 8. And so these are some of the ways that we're working with our patients at end of life that do really, really are not being able, they're not, maybe not, are not mobile, and really have some other challenges that don't allow them to participate in activities. So we're bringing it to them.
I love that. I love that. Our communities have something similar with Essence. It's a pillar of our signature Embrace program, and you're right. Having that spa-like environment is really key to help with some of the behaviors and symptoms, especially the sundowning and such. So that's great. I love hearing that.
It makes a big difference. And I mean, I think that our philosophy is that we're always meeting the resident where they are. And many times, especially in memory care, we're seeing them where, and that's education with families, is that they might still be ambulatory, but to be prepared for the decline and what that looks like. But we're able to provide some of these innovative programs that are really unique to us, that really help not just the families, but the communities where they are, to help, because we're not there 24/7, right? And so it's also empowering our partners to be able to present some of these programs to them when we're not there. And so I think that's important. And the reality is, it's about the quality of care, and really that's what what's important for our team as well.
Absolutely. There is another question from Dawn, who's sharing that, of course, we know technology is a great way to keep seniors connected. However, if there's a fixed budget and, wanting to know about help and resources for Medicaid recipients and those that are on Social Security where income is not too high. Dawn, I can share with you my phone number. I did in the chat as well. I would be happy to connect with you and help you find resources. Our programming department also might have some great ideas of how to keep your senior engaged and active at home without the use of a lot of technology, but definitely there are resources that can help. So I can email you, and then also feel free to call the phone number in the chat anytime. And then Jackie, for that same question, do you have any feedback on that?
I do. And so obviously we're we have a lot of our residents that are Medi, and we deal with this pretty much on a daily basis. One of the biggest things that we're seeing now is that making sure that they actually have the support in home IHSS. And so I bring this up because so many times when we come in, we become their family, and that's wonderful. However, sometimes our patients don't really know that they have these resources available to them. So we've been able to utilize in-home support services, and being able to have, because they can still have a caregiver come in, and that's no charge to the patient. But that caregiver, then we provide the training on how to care for that patient. And so there's a lot of things that they can help them with at home, especially if they do not have the income. There's a lot of resources, Meals on Wheels, that really are at no cost to the resident, the patient. And so I think it's being able to find out what they have, and then for us, we involve our social worker as well, is to expose them to these other resources, because they are out there. And if they're a veteran, we work with a lot of veterans that we find out all of a sudden that they actually have veteran benefits that they they absolutely did not know that they had. So helping them initiate that process as well. And I think that it's really, again, we're meeting our families where they are. There are some that don't have families, and so then we guide them through that process. We have a foundation. We've actually been able to provide some of these grandpads through that. And because that's something that's helping, we're doing telehealth. That's at the end of the day, this is the way that we're practicing medicine. And mobile physicians are doing this. We have everything moving and migrating into telehealth. But you're right, there are some families that don't have that. We can provide that for them. And there are other resources as well that will provide that. It's just, we just need to ask. So just know that they're really, I think that most of the community now is looking at that. I can share some of the resources that I have and making sure that our families have what they need at home.
Perfect. That's great. That's great, Miss Jackie. I appreciate you so much. I don't believe we have any other questions. So I did want to thank again Jackie and everyone there at Optimal Hospice Care. And thank you all, the attendees as well. We appreciate so much your time. And we will go ahead and send out the PowerPoint presentation. And then Jackie, in that email, I will make sure that your contact information is there. My information will be there as well, so that we can, be a resource to all of the attendees here. If they need any more support on finding ways to keep their senior active and engaged, finding resources for care. The help is out there. We could definitely be a resource. So thanks again, everyone, for your time. Have a wonderful day and stay safe. Thank you.
Thank you, Terry.